thank you very much. I wish I could be there with you, but one of the costs of the pandemic is enforced immobility, and that's going to be the topic of my talk. So I'll move directly into the presentation and hopefully answer questions afterwards, if there are any. I'll start with a few definitions and then look at some very quickly some trends over the last 2 decades in mobility and immobility, and then examine immobility as a risk factor and/or as a protective factor to the pandemic, and then discuss briefly what we might be looking at in terms of issues in immobility and mobility in a post-COVID-19 world. So first of all, the UN Migration Agency, or IOM, in a non-legal definition, defines a migrant very broadly: somebody moving within or across international border, regardless of status, voluntarily or involuntarily, regardless of cause, or regardless of length of stay. That doesn't necessarily help us much, but it does define what migration generally is. I would suggest we look more specifically at 2 definitions. One from the UN: an international migrant, any person who changes his or her country of usual residence, generally measured by someone who is living in a country that is not their country of birth. More importantly, this is an area I think we've overlooked somewhat. We need to focus on visitors, tourists, casual movements of people, both within countries but across borders. I'll be focusing mainly on the international movement of visitors tourism. And this is from the UN World Tourism Organization. Some of you may not know that there even such an organization or exists, but we'll look at some of those numbers very briefly. The IOM World Migration Report for 2020 looks at some basic numbers from 2000 to 2020, and this is actually 2019. This is pre-COVID numbers. We've seen roughly a doubling of international migrants in the last 2 decades. We've seen a doubling of refugees. We've seen roughly a doubling of internally displaced persons, some decline in the proportion of children. That's following declining birth rates worldwide. And we're seeing generally the same numbers and proportions showing up in Oceania and countries like the UAE, producing higher proportions of international migrants. Now, we're talking about migrants here, people living in a country that is not their ordinary residence or place of country of birth. When the COVID-19 response was developed, WHO based its criteria for response on the 2009 guidelines for pandemic preparedness and response. On the left-hand side, you see people with illness stay home, implement social distancing, encourage reduction in travel and crowding of mass transport, cancel, restrict, or modify mass gatherings, and consider implementing entry and exit screening. On the right-hand side, you can see things that it did not encourage. One was international closures of borders. It did not encourage use of masks by well people. It did not encourage restrictions of travel internally, except where it involved a globally led rapid response and containment operation. And the question we need to ask ourselves is, what post-COVID might be changing in terms of WHO guidelines and our own thinking about how we protect countries from spread, both internally and internationally. When we look at international travel restrictions, the UN World Tourism Organization notes that possibly for the first time in history, we have international travel restricted by every single country in the world has imposed some kind of travel restriction. Either partial or closing, full or partial closing of borders, suspension of flights, destination-specific travel restrictions, and others. And so we are seeing really a comprehensive containment and ban and restriction on international travel. It's not time enough in this presentation to talk about all the many different ways in which different countries have imposed internal restrictions. You can see the picture on the right-hand side. This comes from the UK. Seafront closed, car parks closed, go home, stay home. The US CDC guidance was, as I'm reading, because travel increases your chances of getting infected and spreading COVID-19, staying home is the best way to protect yourself and others from getting sick. So we see restrictions on mobility being protective. The question is, who is more at risk of some of the threats, if you will, of immobility, as well as some of the threats of continued mobility? The UN World Tourism Organization predicted, if you look at the trend line from 2000 to 2019, small dips from 2003 SARS declined about 3 million movements of tourists. 2009 global economic crisis, much more substantial, about a 4% decline. They were projecting and are projecting a decline of as many as 1 billion arrivals. So we'll see a much smaller number of people moving. This was their projection based on different scenarios, 1, 2, and 3. I won't get into the details on that, but empirically, we see these data bearing out. If you look at the right-hand box from January to April, substantial declines in international tourist arrivals. And in the lower boxes, you can see proportional declines, more substantial in Asia Pacific, probably because with the origin of the pandemic in China, that was the proximate countries were moving more rapidly to begin to restrict travel, but this became ultimately quite comprehensive across the globe. Declines in movements of people, in this case, movements of tourists, people moving for business, pleasure, travel, family reunification, and so forth. Not migrants, not refugees, not long-term asylum seekers, but tourists. Chinazzi et al. In a journal article in Science looked at what the effect of travel limitations might be on national, international restrictions and limitations on spread of COVID-19. And I won't get into all of the details, and certainly won't try to track you through all of the different changes in movement patterns on the left-hand side, but you can see before the Wuhan travel ban, movements from Wuhan into Thailand, Japan, Taiwan, South Korea, and so forth. When the travel ban was implemented in Wuhan, people came from other parts of China. So restrictions are difficult to implement. You can't stop everybody in all places from moving. And indeed, they suggested that a sustained 90% restriction on travel would only modestly affect the epidemic trajectory unless, and this is a key point, combined with implementation of higher reduction of transmission within the community and within internal boundaries. So what's the message here is what we're trying to sort of unpack. A very interesting short article by Lazareg and Garnawi looks at sort of how we might conceptualize travel, mobility, and immobility and how its effects might bear out on the pandemic. And they note, for example, citizens from the global south whose elementary freedom to move had been historically curtailed due to the imposition of visa passports, travel regulations, restrictions, now enjoy a kind of safety as the immobility shields and protects them from the vastly infected Europe and USA. And they cited something called the Hanley Passport Index. I had never heard of it before, so I looked it up and did some very rough rankings. I'm working on some additional analysis of this, but basically the HPI, Hanley Passport Index, says you get a 1 for every country for whom your citizens have a visa-free access passport, and you get 2 if there's 2 countries and 3 if there's 3 countries. These are largely reciprocal. So a country that allows you to move visa-free, generally you allow those countries and those citizens to move also visa-free. Japan has the highest score, 191, and Afghanistan has the lowest at 26. Looking at this table, and there's a lot to look at here, what I did was track Hopkins data from confirmed cases, deaths, case fatality, and deaths per 100,000 population, looked at Human Development Index metrics, the Inform Risk Index, which was a measure of natural and human hazard exposure for 2019. Again, pre-COVID, the number of international migrants living in those countries gives you a sort of measure of people from outside that country, not their country of birth, living in places like Japan and so forth. And then the Passport Index. So 191, again, is the highest connectivity, most integrated in the global network, and on down. So I did the top 20, and I'll show you that lowest 20. I'll work from the bottom, if you don't mind, and you'll see really the red shows countries where there's high global connectivities. United States, United Kingdom, Belgium, Sweden, France, Spain, Italy, and many other countries in Europe are also, despite being very high on the Human Development Index, very low for risk, also experiencing some of the very highest deaths per 100,000 population, highest number of case fatality rates. And the suggestion here is that by being connected to the world, people coming and going rapidly, even with some bans, partial bans, people came from areas where there was infection and they moved into these countries in substantial numbers and introduced the virus. Now, this is not necessarily the end of the story. If you look at the top of the chart, Korea, South Korea, Singapore, Japan, Germany now increasingly, and some countries in Europe, despite again being highly connected in this global migration or mobility network, managed to contain the spread through all of the measures that we heard earlier speakers talk about. So the point here is not that I'm not at all suggesting close borders and you'll protect yourself. I am suggesting that in the first few months, this global network of travelers seems to be very highly correlated, absent really effective internal mechanisms to contain, test, contact trace, isolate, and treat. Absent those measures, you get widespread introduction of the virus, and you've seen countries that you might have expected because of their resources, because of their technology, because of their science, to do better, have actually some of them been the worst performers in the world. And governance matters, politics matters, all of that matters. I'm just suggesting to you that one of the other metrics we might be thinking about is this global network connectivity. Let's look at the alternate. At the bottom 20, the countries that are least connected in the world, lower middle income countries, countries with high risk for hazard and exposure, poor health systems, where we probably would have expected this pandemic to hit early and certainly hard, have been somewhat spared. If you look at their HPI, the Hanley Passport Index, there's not many people moving in or out of Afghanistan or Iraq or Syria. Is this protective? The deaths per 100,000, the case fatality rates, the total number of deaths might suggest that for a few months at least, and a precious few months, there has been protection because people are not moving to these countries and connected. These countries are disconnected, less integrated into this global mobility network. The question I think we have to ask is, what will they do with that time? Have they built up other measures so that when this pandemic comes, and it will cross every border, it has already, even countries that have 0 cases will, I think, almost undoubtedly get some. What will they do with the time if they have, in a sense, this disconnection might have purchased them? And I've offered 2 red highlights, one in Iran, where they did see very early high levels of mortality, deaths per 100,000 of 16.6, 13,000 deaths, and Yemen, which is experiencing a war, relatively low deaths, but certainly high case fatality. That may suggest there's not enough, certainly not enough testing. But we need to keep our eye on this population. But again, I come from a Center for Humanitarian Health at Johns Hopkins. We were expecting to see vastly more higher levels of cases and morbidity and mortality in countries that were in lower resource settings with higher risk profiles, and of course with lots of immigrants and refugees and asylum seekers. They're not protected. I've not put any of these countries in green. Nobody's safe, but I am suggesting that this global network connectivity, visa, passports, international travel, and the rest, may have kept them, if you will, off the grid and bought them some time to respond to the next wave. So how do we wrap this all up? I'm not trying to make this a one-factor equation. It's not at all. There's many factors involved, and the international spread, and many more factors involved in the internal spread or containment. But I am suggesting that this level, a country's level of global connectedness vis-a-vis international travel has been a key factor in the first 6 months. And this is a point that Lazareg and Garnawi also make. In many people's imaginations, closing borders means repelling migrants. But COVID-19 has ridiculed this assumption. This virus spreads from one country to another via travelers of all kinds, without inquiring whether they are migrants, expats, or tourists. I would add returnees, citizens returning from overseas, and so forth. It moves with people. very effectively, and it moves largely by airplane, but also many other mechanisms. But it moves more rapidly where the ability to move is more wide open. Post-COVID, I would suggest we need to re-examine both the risks of mobility, but also who mobility is privileged, people who have passports, people who have money to travel, and the protections of immobility, and who mobility has harmed. So I'm not suggesting poor people who cannot travel, or people who are restricted from crossing a border, a refugee, asylum seeker, or migrant, that we should reinforce those immobilities or barriers, but rather examine this dynamic and this construct of mobility and immobility, who is harmed, who is privileged, and see if we can promote more comprehensive and coordinated prevention efforts within and outside borders, and within and outside many other boundaries, including socioeconomic status, access to health care, and the rest. I'll leave you with that and with my references, and thank you very much for your time.
Mm-hmm.